have a duty as a system, as a profession, to respond to the question around how long do I live with another question, which could be something like, what would you be doing differently if it were 3 months or if it were 9 months?
Dr. Jeff Myers, the head of palliative care at Sunnybrook Hospital in Toronto. 2 years ago, we approached Sunnybrook with the idea of taking a unique look at doctors and nurses. So how would it be different from the usual ER take? Well, this series would focus on how the work carried out by these professionals impacts on their personal lives. For example, Dr. Myers is not focused on curing people or saving lives, unlike other doctors. Instead, he's a passionate advocate for patients in their final days. Tonight in an encore presentation, Public Health Private Lives has a rare glimpse at what can be done when there's little left to do.
Hey, it's Jeff Myers from Palliative Care. From Palliative Care, I was paged. Just going to see a patient with a resident who called me. She's not quite sure what to do, wants me to lay eyes on the patients with her. So we'll see. Hi.
We're socialized in the profession to heal, to reverse injury, to fix things in people. And it's in direct contrast with the reality that every person is going to die.
Let me ask you this. What's your gut tell you?
I don't know. It tells me I'm done. I'm 84 years old. I'm done.
So then what are the things that are important to you then? Right? If your gut tells you you're done, what's important to you?
Just to be free of pain.
Okay.
That's the thing.
Okay.
Because you can't do anything when it's so painful.
Okay. There's nothing urgent that we need to change in this moment. I needed just to come and meet you and
Right.
say hello and look into your eyes.
Yeah.
That's all. So the next patient that we're going to see is a gentleman. He has metastatic prostate cancer. Metastatic means that it's spread to his bone. And we were asked to see him to try and augment the pain relief that he would potentially receive from the radiation. Our role is not to reverse disease process, but the intent is to make whatever process through the disease more comfortable. Hello, sir. Good to see you today. Let me grab a chair.
You're walking around, you're working on a Tuesday.
Yeah.
And the next day and a Wednesday, you can't get off a cot.
Yeah. So what I would encourage you to do over the next couple of days, because I think these days, the next couple of days are quite important, is to, God, how do you say this without sounding hokey, but like celebrate the small victories. Like,
Now, if a person dies in pain and the resources that are available to them haven't been accessed, that's an injustice.
Truly for us, it's a wait and see as well. Thank you.
Thank you.
I appreciate it very much.
No
Yeah, very, very, very helpful.
Talk again.
Very grateful. Yeah, I'll see you tomorrow. So this hour has become really important to me in the couple of times during the week that I get it, because I'm out of it. Like I'm in somewhere else for an hour. And if these triceps don't get witnessed on Pride, I'm pissed.
I think I have a good sense of humor, and perhaps that's the coping mechanism, is to just be oneself.
Ready? All right. Are you guys sucking? You're totally sucking right now.
Jeremy is my husband, and we've been married for 2.5 years. He has spent almost his entire professional life working in a theme park, and somehow the universe thought it would be neat to put, you know, Jeremy together with Jeff, who's a palliative care physician. So actually that's the difficult part at dinner parties, is not so much explaining what it is that I do, but how it is that we sort of make sense.
Hi, Sheila. You won't get Jeremy to say that I work too hard or work too much. We struggle with that. I struggle with that.
There's times where I wish he worked less, but I know he loves what he's doing, and he really feels that he's a champion for palliative care. And so how can you argue with that, right?
So are you moving your legs, pushing?
It was this morning.
Well, that's good. Yesterday you couldn't move that leg at all. He has his good times and his bad times, but yeah.
In addition to talking about his pain, we started to explore yesterday, you know, the unexpected things that he's needing to think about and face right now.
We have a duty as a system, as a profession, to respond to the question around how long do I live with another question, which could be something like, what would you be doing differently if it were 3 months or if it were 9 months?
What would be helpful for you today?
One of my doctors to walk in and say there's been a miracle improvement, and you're going to walk tomorrow.
Okay.
You can go home on Friday.
All right.
But I'm pretty sure that's not going to happen.
So then what could we do today?
Just make me as comfortable as possible, I guess.
He holds it together when he's with the patients, but when he leaves, he calls me crying. And I think anyone would.
Have a good day. See you later, babe. I love you. See you later.
I don't think about my own death. The only thing that I've thought about is that, and this might sound terrible to say, but that probably Jeremy will die before I do, because I wouldn't want him to have to experience that.
Good morning. You gotta drink your water. 2 liters a day. 4 liters a day? How much am I supposed to drink a day? Most of my friends don't actually think I'm a real doctor, and it's moments like this that I wonder myself. Maybe it's 3.
You too.
For me, I enjoy conversations that have nothing to do with medicine.
I see you wore your best tank top, Neil. That's sweet of you. Thank you. So really, you guys are boyfriends now? That's right.
People ask me tons of doctor questions, and part of the problem with palliative care is that one doesn't really keep up with the actual regular medicine.
Yeah.
Cold sore is herpes virus.
For your herpes. That's what it is, though, isn't it?
Let me see.
Oh, perfect.
No, I don't think that is. No, I think it's from kissing too much.
Aww.
It's important for me to be competitive and appear like a doctor, so as long as you just answer confidently and you know deep down it's not really serious, then it's no harm, right?
Mary, line 2, please. Mary, pick up line 2.
I'm always met with, wow, that's heavy. Wow, that must be so depressing. How could you do that? But to be involved in a person's life when they are uncomfortable and I'm able to actually improve their comfort, that's incredibly gratifying.
Hey, buddy. How are you? Good. Sleepy today? Yeah. If this dose is all of a sudden too much, then my thought goes to, excellent, radiation's kicking in. We can cut back. So it's good news. All right?
You know, you get to witness these moments of just amazing humanity, and it's just so simple. When I am reminded of the greatness of being a human.